When we start down the pathway of talking about surgery, we want to talk about the rationale for surgery, why we're doing it, why are we doing a biopsy versus a resection. And in so doing, we always have to keep in mind the issue of the risk factors. So we go over that very, very carefully, and the risk factors and those issues are highly dependent on where the tumor is located. And we use imaging studies such as MRI to define the location, and then we use functional imaging such as MRI to define the functional tissue and the proximity of that functional tissue to the anatomical area involved with that tumor. By functional tissue, what I mean is areas in the brain that control certain essential functions. For example, language consists of motor speech, which is the act of talking, which is what I'm doing currently by moving my lips and my tongues and my throat. And then also the cognitive aspects of language, which has to do with comprehending written language, spoken language, the ability to read and understand and comprehend all aspects of reading, calculations, things like that. Then there are the other aspects that we are interested in, such as the motor function. What part of the brain controls the motor function from the face all the way to the toe? And then the sensory function, the ability to determine pain and temperature, or proprioception, which is the ability to know where a given part of the body is at any time in space, in three-dimensional space. So these are all critical functions. Another function that's critical is vision. And of course, a very difficult function to determine and measure is memory function, although we have clearly some insights as to where that is located and therefore how it could be impacted during surgery.